But what we're seeing when we see that agglutination is either present or moderate or high or whatever they're reporting it as, basically that means that they're seeing clumping amongst the sperm, and they can clump at the head, they can clump the body, they can clump at the tail. And a lot of times I see practitioners just kind of breezing past this as like, it's not a huge deal. And I think part of that comes from the premise that they're likely just going to refer you to do IUI or IVF anyways, 9 times out of 10, depending on where you are in your journey, your age, yada, yada, yada. They're likely seeing it and saying like, well, we're going to do this anyway, so that no longer matters. But it does matter if you are doing timed intercourse, whether it's medicated or unmedicated, doesn't matter. This agglutination piece does matter. And I would argue that even if you're doing IUI or IVF, we still want to investigate this a little bit to see if there is a root cause issue that might give us more information that would play a role. So what does that look like? Why does this potentially happen? And taking a good thorough history is always really important, because one of the reasons is previous scrotal surgery. They see men that have had scrotal surgery have like a 2 times higher or 3 times higher amount of sperm agglutination. So wanting to see, okay, the surgery is something we cannot change, right? But it's an explanation for what's going on, and it may help to make the decision of moving forward with various assisted reproductive technology techniques make sense, right?